about 40 minutes or so, a little more, to really reflect on the work of the past year and also to think about our commitments moving forward. What are some of our challenges, priorities? And I've heard from a number of people in the session that preceded the time that we have now, some ideas of things that we should be prioritizing. So with that, I'm going to open it up just to all of the PACHA members to kind of maybe share some perspective on either the meeting today or things that you see us needing to continue to address as we move forward. Carol?
So first, let me apologize to the chairs and the staff. Again, I'm just learning the process here, not understanding what's the public comment, how it's different from an open meeting, and et cetera. So my remarks at the end of the public comment I see now should have been saved to this part, but frankly, I just didn't know.
They were perfect. There's nothing to apologize for. You did a beautiful job, and I think you set the stage for what we're going to talk about now. So thank you very much.
Yep. So I'll just say ditto. Do you want me to repeat it, or?
Well, I did want to respond because I know that Tori and Guillermo are chairing the EHE group, and there is active work that is occurring in that group around workforce. There's actually been a tremendous amount of work that has happened in collaboration with CHAC and also with PACHA, thinking independently about how we can best address some of the workforce issues. And so I don't want to steal the thunder of Tori and Guillermo, but what I will say is that EHE subcommittee has been addressing this, and there's plans to do more and to sort of carve out work that Wendy Armstrong and I are leading on PACHA with some subcommittee members. And it sounds like there are a couple of people that haven't been identified. I'm probably thinking, you know, Carol, certainly of you and others that might want to be involved in that work group where we put something together with CHAC. And so that is work that is happening. And I think we do recognize that it's a huge area.
Yeah. Yeah. And I again, just feeling my way here. I think workforce issues are bigger than EHE. And of course, they greatly impact EHE, but I think of them as bigger, right? So not aware that was a focus within EHE. So I think about, what about global workforce issues? You know, what about, workforce that addresses and is responsible for perpetuating stigma, you know? So again, I'm learning my way here, but I would be happy, very, very happy, as you can imagine, to be part of any effort that is looking at workforce issues across multiple domains.
Yeah, I mean, I think a short answer, Carol, would be that we would love to have you in the working group, and how about we count on you being part of that?
Okay. Jen, I'm still with you. If Jen Cates is still on here, I'm still with you, Jen. Yeah, there you are. Still with you, Jen.
Yeah, you can be on more than one subcommittee, working group. Go for it.
Sure, thank you. So Guillermo and then Jen.
Yeah, no, I just want to reinforce what Vincent just shared. Tori and I, we're solid, committed to advance. I mean, obviously, Carol, you're right, and I'm sure several PACHA members are on the same page. It's a global issue, a workforce. And actually, part of the conversation is we need to frame it more like a public health workforce, because at the end of the day, as we know, as we're facing a giant aging population living with HIV, it has to be in the context of comorbidity and several other challenges when we look to address who is the population most impacted. But the other issue that I want to highlight to all of us, I think, that every panel, I think, highlight issues that we need to also take into our own organizations and our own networks. Because to me, PACHA is a place that we are able to truly bring several issues, and it's a lot of intersectionality here. But the most important thing is to take it back to our own networks. because I truly believe that the best way that we can advance in a very difficult political environment, as I think Mackenzie was reminding us, and somebody else about how difficult it is and critical funding on the chopping block, all hands on deck at the end of the day, outside this space, obviously. But the other piece that I want to also share with all of you is I mentioned that several of us are putting together this National Hispanic Latinx Health Leadership Summit coming to DC on May 5th and 6th, that is health policy oriented. And several of the issues that have been discussed in the previous PACHA meeting and in this one, and the committees will be broadcast, because I cannot ask someone to do something if I'm not willing to apply it to my own work and my colleagues that we work from Puerto Rico to California, from Illinois all the way to Louisiana. And finally is to truly say thank you to the agenda, the organizers of today's agenda, because it really challenged many of us, things that we take for granted. But when you elevate and you make visible voices that are not really in many platforms, challenge again, the commitment and fine tune the way that we need to be more responsible, how to deal with difficult issues. But I believe together we will be able to advance. Thank you, everyone.
Thank you, Guillermo, so much. Many, many important comments, and really appreciate you highlighting some of the work in the Latino community. Thank you. Jen?
Yeah, I want to just echo what some have said. I think it was a great meeting. The panel format and the way it worked out and how rich the discussions were was just terrific. So thanks to everybody. I know those are hard to put together, but I think for some of the newer members, it's a good model as we go forward. So for example, if we do something on workforce, which PACHA has done in the past, but if we do something on workforce, we could do it oriented around a panel discussion. But the thing I was just going to say, one thing that we could do as PACHA, or probably should do, is from all the inputs that we've received today, think about what work still needs to be done in those areas and for us. And that could be as basic as identifying some policy levers that might already exist, but sort of identifying them and figuring out who the audience is for those. So in some cases, it could be the secretary. In other cases, as it came up in our PACHA to the People session, if it's states, then there are still levers that the federal government has to talk to states about best practice and things that states can do to promote access, to increase their workforce, et cetera. So whether it's or any of the issues we discussed today, I think we as PACHA and some of the subcommittees should work to identify the levers that might be able to be used to make change. In some cases, we might need to do further work to figure out what those are. But I just that's one way I think PACHA can work effectively, identifying those and then crafting some kind of letter or some other communication around those to the secretary. Thanks.
So Jen, certainly don't want to put you on the spot, but loved what you just said. And so not necessarily asking for you to respond to this now, but if you do have a response, feel free. I wonder if you have a suggestion about how we might think as an overall group, as PACHA, to identify those levers so that we're not sort of siloed in our subcommittees.
Yeah, that's a great question. I think that the first thing is we'll get the minutes, we'll get the information. We have some of the record from today as well as the presentations. In some cases, we do need some subset, I think, to take a lead. But in some cases, and there's overlap, but I'm thinking of other times when a couple subcommittees worked together on an issue and had additional meetings often with federal representatives on a specific topic to sort of say, okay, here's the challenge. How should we think about it? The other thing that we did that worked well, if I'm remembering correctly, Kay and Carolyn, if Carolyn's here, is we had a sort of working strategy session of the co-chairs and the subcommittee, the working group chairs, where we actually talked through in a more detailed way these kinds of issues and sort of said, okay, so on FDA policy, because at which it actually worked. You know, we talked with Harold about what the FDA policy trajectory could be to make that change and what needed to happen, and kind of laid out a roadmap. And we did that on a number of areas, some of which are still in progress, but it really worked well, I think, because we have to make it a little more concrete. So my suggestion is, once we see the readout, figure out if it fits in a subcommittee, who can take it on, or if there's some additional work that maybe the co-chairs with the working group chairs could do together to kind of move that forward.
Sounds like a great.
And that's
suggestion.
perfect, Jen, because actually Marlene, Vincent, we had a small team meeting talking about just what you said, and really thinking about how to intentionally have that gathering of the subcommittee co-chairs, the co-chairs of PACHA from that strategic vision. So more to come on that. But
Great. I'm an old timer on this, so I remember that.
Perfect.
Marlene?
Yeah, and hopefully we'll be able to tack that on to our convening early in the year. So it really sets our strategic plan moving forward. The other thing I wanted to lift up in my own sort of reflection of the year, I think the continued work around molecular HIV surveillance has been palpable and felt by community, the work that PACHA led there and is continuing to lead there. And another strategy or tactic we took there that we might be able to apply for addressing workforce as well is there was a separate, very specific convening just on that topic issue alone. So PACHA has the ability to do that. We just oftentimes have to negotiate with Kay on whether or not we have the budget to do that, but we certainly have the ability to convene a very specific conversation, whether that's a day-long, intentional discussion, or 2 days, or a day and a half, however we organize it. But you know, in the case of molecular surveillance, it was led by stigma and disparities, and so in a similar fashion, EHE could lead. But I think representation strategically, as has already been discussed, might be important for such a convening. But I just wanted to lift that up as another possible avenue or tactic we might be able to take to address overall HIV workforce needs.
Thank you, Marlene. Jesse?
Thanks, Vincent and Marlene. Since this is a sort of wide-ranging discussion of where we've been and where we might want to go based on what we've heard today, several thoughts have actually come to mind for me, especially for my subcommittee. It seems that there may be some legislative issues that we could recommend that the secretary push through his Office of Legislative Affairs or through the Assistant Secretary for Legislation, like what has PACHA said, or what should the secretary make sure his team is doing with regard to the Older Americans Act? What should we say the secretary should do with regard to his legislative team with regard to the HOPE Act? Those may be very practical solutions. But I've also heard some additional programmatic solutions, like from the panel on HIV and aging. What are we doing about new models for long-term care? And I don't know whether the Ryan White program has actually identified what those possibilities might be. And so I know that PACHA has met as a liaison to the CHAC, and that may be a role that we can play to make sure that the CHAC hears some of the things that they need to be thinking about specifically with regard to the HIV/AIDS Bureau, and also on PrEP, as we've heard from many panels today, what the CDC may be considering with regard to access to PrEP. So those are some of my thoughts. But ever since our first PACHA meeting for the new members, I've been thinking a lot about how does PACHA engage with not just the Assistant Secretary, or not just the ASH's office, but the Assistant Secretary for Legislative Affairs, so we can actually hear what are their priorities, what are they doing, and how are they addressing it, that dovetail with exactly what we're thinking and what we're knowing should be done to advance our agenda in Congress.
Thank you, Jesse. So I'm gonna maybe just chime in with my own reflection, and maybe that'll give folks a chance who haven't spoken to weigh in as well. I thought that today's meeting was absolutely fantastic, and I certainly learned a lot and was moved by much of what I heard, and particularly among the panel members. I want to maybe go back just for a second to our very first presentation, which was Director Harold Phillips. And so, Harold, I thought you did a fantastic job at sort of framing where we are. And I realized that it's pretty nuanced. I think, one thing that I took away was certainly that we have made progress, but that progress has been uneven. And I think that that was something that you were very candid about. And I certainly appreciate that, because I know that's sort of a tricky way of framing things, particularly when there are folks that may be potentially critical of the work that we've done as a community for decades. I want to point out that it's not just uneven progress. There are some groups and some communities that have actually had a significant worsening of their HIV circumstances. And, one group that stands out for me are young MSM of color. And I appreciate very much that we're talking about many groups that all are priorities. And I don't want to in any way sound like I'm splitting or making comparisons, but I want to make sure, as someone who has committed my life to working with youth, that we're not forgetting about young MSM of color. The numbers are shocking. And I think that the increases in incidence are quite pronounced. And so somewhere I would hope that as we think about our work going forward, that we can kind of address that. And so just wanted to share that. Harold?
So I will say thank you for that, Vincent. I feel as though as we think about the work, as we think about the groups that you mentioned, which are of great concern, because I know that for years there had been sort of this feeling of HIV inevitability among Black and Latinx and Hispanic gay men, especially the young. And that was really prevalent, I think, even before PrEP. And I think that with the advent of PrEP, we still have a lot of work to do, as the data sort of shows, to get PrEP into those communities. I think we're also at this point in time facing an increase in both stigma and discrimination among our populations as well, that is being sort of layered on by many of these state laws and efforts to sort of ban this or ban that. And so it's also not helping us. One of the things that Dr. Fauci said in one of our World AIDS Day commemorations is that stigma and discrimination are the enemies of good public health. And it really made me think about, what we know in terms of the science and the innovation. And yet, if we're still not able to combat stigma and discrimination, and I would add to that, misinformation, that we're not going to get where we need to be. And so really, I've been thinking a lot about that over these past couple of days, and thinking about how do we weave and embed that really important aspect of all of this into the work, whether it be work with the workforce, whether it be some of the other pieces, really and truly ensuring that there is that element of addressing stigma and discrimination and misinformation, and especially among some of the populations that you mentioned, Vince, that I think, really and truly are getting hammered by this, and it's contributing to the poor health outcomes.
Thank you, Harold. So just want to quickly recognize and acknowledge, Tori, your comment in the chat. And I see, Alicia, that you agree. And so noted, definitely agree. I'm going to turn it over to Paul.
Well, thank you I appreciate this meeting. And Harold, I don't know if you always attend all these meetings, but since you are here, I thought I would corner you and ask you, we want, at least for me, I want a PACHA that supports the administration, supports the president. And so in your listing of huge and multiple priorities, what do you think it's important for PACHA to be focusing on right now?
Right now, Paul, I would say, hey, this is still the open meeting, right? I'm confused.
Oh, is this open? Oh, I'm sorry. I thought this was just the PACHA folks. Sorry, never mind, Harold. Never mind. I didn't say that.
No, I think so. I will. It just only impacts how I answer the question, but the answer I think is still the same. I think we need to focus on trying to get a national PrEP program, which is very important and is something that the president has included in his budget, but we need Congress to move on that. But we also have a huge issue when it comes to viral suppression. There is a report that came out by the OIG about people living with HIV that are receiving Medicaid and Medicare and are not receiving the level of service that they should. We have got to focus on viral suppression and unpacking all of that, ensuring that individuals are getting quality care that meets the treatment standards, ensuring that we address the social determinants of health, which can sometimes create barriers to access or remaining in treatment, and figuring out what that does, being able to screen and assess in different ways so that we are sort of linking across sort of those databases between housing and healthcare, and being able to spot problems and issues, being able to enroll people who've fallen out of care but still might be in our food bank programs and getting them back into care and re-engagement. And then also retooling the system, because someone said this years ago and it stuck with me. It's like when someone falls out of care, the system isn't working for them. And our tendency is to bring them back to the same system that failed them without making any changes. And so we really got to think about what are those nuanced set of services that someone who's fallen out of care really need to stay in care based on what caused them to fall out. And so it's viral suppression and it's a national PrEP program, Paul.
Thank you so
If
much.
I could chime in, and I think it might be worthwhile for Vincent and I to work together on creating a little bit of a primer for all of our new members on when it's appropriate to speak and when it's not. But I certainly want to say that our federal partners are invited and certainly encouraged at every one of our meetings to weigh in and provide commentary as they see fit. And so Harold almost always gives PACHA priority ideas for what we could be working on that might be very impactful in terms of strategic timing around the administration's work. And so we've always welcomed that. And so not just for Harold and having the opportunity to speak during these sort of open sessions of our PACHA members conversation, but any of our federal partners, if you'd like to weigh in and chime in and provide commentary. So.
Thank you, Marlene. So lots of great comments in the chat. I don't know if anybody would like to sort of verbalize what they've written, but I'm seeing good comments from Daryl and from others. So Daryl, do you want to share your comment?
Thank you, Vincent. Yeah, I'm so appreciative, Harold, of your comment. And when, as you were speaking, the realization and something that's always in my thinking is that we're experimenting with something that never has been. And that we've never had a moment in US history where there hasn't been some out group and there hasn't been some element of litmus testing or exceptionalism that excluded somebody or some groups. And so when we talk about approaches that are fully inclusive, we have to address the fact that it is not benign that we have the system that we have, and the reinforcements within the system, as most systems will try to survive. And so part of what we're facing is not just creating the right systems, but dismantling the hegemonic power of the forces that keep the system the way it is. And I don't think that we can be naive about it. And that's why in a meeting yesterday with our committee, we talked about, compartmentalizing and prioritizing the components of what we can achieve with an always forward goal on getting to that penultimate goal. But that penultimate goal is probably not achievable in our lifetimes unless the Martians come down and force us to work together against a truly common enemy. And, I think in classes, I sometimes talk about the fact that we almost in contemporary time had an experience of the Martians coming down when COVID hit. But for a short minute, everybody was on almost the same page for a short minute for the good of all people. And if we could harness what happened in that moment and then try to, I don't think we can harness it and inject it into people again, but we really do have to be realistic about the fact that this is not a benign process, and that when we're talking about this work, we're talking ever so much more in this horrible kind of climate of vitriol, of people feeling comfortable telling you to stick it somewhere and don't bother me with facts and truth, because I have a whole different approach.
Thank you, Darryl. Thank you very much. Important comments. Mackenzie?
Yes, thank you, Vincent. Just listening to Harold's awesome suggestions. Are there steps that we can take? Are there steps that we can take to prompt or help make a national PrEP program happen? Maybe steps have been taken by previous versions of PACHA, and maybe it's also like contingent on that funding that we referred to earlier getting approved, and so we have to see how that shakes out. But if there are steps that we can take now, I'd love to identify them so we can move even faster.
I'm raising my hand because I want to jump in, Mackenzie, to that.
Yeah, 100%.
But I think that, in stigma and disparities, we're having this, strategic planning retreat in February. And part of what we did in that is reviewing kind of our work within the subcommittee over the past year. And I think we started last year talking about the idea, at least I think in this kind of iteration of PACHA, around a national PrEP program. And I think at least in the stigma and disparity subcommittee, I know that we're thinking about this. So this is, I think, an issue, Marlene and Vincent, I think that raises up to like, what are the priorities? What are the things that we're hearing needs to be responded to, that maybe takes an approach across subcommittees within a working group. I know at least from stigma and disparities, at least the way that I've thought about it is, PrEP is one of those, I think probably one of the best examples that we have of like, you can develop all of the amazing biomedical tools that we want. We actually are going to see widening disparities if we don't respond to that stigma, right? And these kind of like big issues that, we probably aren't going to completely annihilate or change and transform within our lifetimes or even our children's lifetimes. But how do we try and do this in a way that it doesn't doesn't increase disparities, which is what we've seen, honestly, with PrEP. And so I would hope that any kind of recommendations that this body can make around a national PrEP program that I think we can do, I'm thinking about how do we do that in a way that decreases disparities. And I think we've heard some great recommendations from advocates and organizations across the country on this. And I think as a PACHA that has diverse expertise and experience, that we have an opportunity to think about how can we make recommendations to the Secretary for the national PrEP program in a way that does reduce disparities and hopefully gives us a model and some ideas for what we think would be useful as other innovations occur.
Thank you, Rhonda. So I see 3 hands up. So Marlene, before I call on the next 3 members of PACHA, I just want to do a quick time check. How are we doing on time, and when do we need to wrap this part of the agenda up?
I think we are good for another 10 minutes or so. So I think we're good for the 3 comments.
So I see Jesse, Leo, and then Patrick in that order.
Great, thank you. I'm glad that McKinsey raised this. Yesterday at the Public Policy Council meeting, the PPC at AIDS United, we had the Deputy Administrator from HRSA, Jordan Grossman, and also Heather Hoke, the Deputy Director of the Division of the HIV/AIDS Bureau with us. And this question came up. Is there going to be a national PrEP program that's going to be administered at HRSA? And their response was, well, we don't know. And so I think we've got a couple of questions here that maybe PACHA can start weighing in on, because Harold has made it clear that the president's has put this in his proposed budget and is likely to continue to do so. But the devil is in the details as to where a national PrEP program would be housed and what would it do. And PACHA can actually be quite helpful in helping to recommend where it goes and how it's structured. It's not entirely clear that it would be managed by the HIV/AIDS Bureau. It might be managed by the Bureau of Primary Care. It might be or FQHCs. There may be aspects of it that need to be done under the Bureau of Workforce Development. There are all kinds of questions, and CDC is probably not willing to be left out of the mix. So there may be a lot that we can talk about, not just there should be a program, but how should a program be structured? And frankly, that could cross-cut almost all of our subcommittees.
Thank you, Jesse. Leo?
I agree with that, both what Rania shared and Jesse. Just wanted to add on, I think this is a great opportunity while funding is being identified for us to look at some of the existing programs and what's working and what's not working. So thinking about the Ready, Set, PrEP program. In California, we have the PrEP Assistance Program as well. So I think there are opportunities for us to see what's working, what's not working, to build some recommendations. And then I also want to mention, I know that the name of the program is the National PrEP Program, but I do want to ensure that we're also thinking about PEP as well. As we do have a lot of people who can benefit from that. And honestly, a lot of folks don't know that PEP exists and is an option. So just wanted to add that as well. Thanks.
Thanks, Leo. Patrick?
Yeah, I'll just add a short point to Rania's point and to Leo's point, which is that based on it's not experimental evidence, but based on the policy analysis evidence that we have, that the states with PrEP-DAP programs do better with equity. And I think, Rania, to your question, which is absolutely right, which is not just how do we do this, but how do we do this in a way that reduces the inequities, that the people who need PrEP most are not the ones who are getting the most PrEP. So PrEP-DAP programs just are the premise that sort of out-of-pocket costs to the greatest extent possible are mitigated in the real world seems to do that. So I think that just speaks to what the components of that program are. Medicaid expansion, by the way, has the same effect at the same magnitude. So I think everybody's on the same page with this, but just continuing to say to the states that have not yet expanded Medicaid that also raises the boat and decreases inequities.
Thank you, Patrick. So Leo, I think you have our final comment, and so I'm going to turn it over to you.
Thank you. This just brought up one more point for me. We really need to advocate for additional funding for navigators. Because in our program, I see how so many of our patients are staying connected to care because of our navigators, like being able to have them help with housing issues, with transportation issues, reminders, etc. So, however this program will look, I think navigation has to be a key component of it. Thanks.
Mm-hmm. So Marlene, I'm going to turn it over to you to kind of help us to start wrapping up our meeting.
Yeah, and just echoing Leo, an army of navigators, quite frankly. And I just want to thank everyone for what I thought was an extremely productive day. For all of our new members, I'm excited for the energy, and we have a lot of work to do. And so I'm looking forward to 2024. I will say to you, just for logistics, we are looking forward to scheduling out the year of 2024. I know that is helpful for many of you. to be able to determine when we're going to meet, where, and whether or not it will be virtual and in person. So that is absolutely next on our to-do list. Vincent and I to work with OASH leadership to figure that part out and share with everyone. Also, as you know, as chairs, we have been historically divided in terms of our time and representation on subcommittee work. And so Vincent and I had a chance to meet and have, I just wanted to let you all know that we've decided that I will continue representation on stigma and disparities and will now join the global team. So excited to join you, Jen and Patrick. I'm looking forward
Yay.
to that. And Vincent will carry on with ending the HIV epidemic subcommittee, and he will also support aging. So between the two of us, we will make sure that we are providing necessary support and input and feedback on those committees. And just really wanting to thank Harold from his seat at the White House of National AIDS Policy for your level set earlier this morning and really highlighting those jurisdictional successes. And again, all of us understanding those facilitating environments that support making those successes happen. We have to dive deeper on that and really make recommendations that expand on those successes for, as Vincent eloquently said, those communities that are being left behind. I also want to say that we are going to make sure that all of you are supportive and active on committees. So I think everyone has signed up on a subcommittee, and so I appreciate that. Some of you for multiple subcommittees, and we need you. So I appreciate that. And then lastly, I just want to close out with a thank you to Kay. Kay and the team at the Office of Infectious Disease and HIV/AIDS Policy, who supports PACHA in ways I can't even count. The technical team at Rosalie and Associates and HHS Studios, you keep us looking like a well-oiled machine. I really appreciate that. And to everyone who has supported the PACHA to the People and the public comment, all of our community advocates and partners who, risk it all and are vulnerable in ways that I cannot express enough appreciation for continuing to share their story, share their experiences. I heard a lot of it today and it went direct to the heart. So with that, I am excited to turn it over to my co-chair, Dr. Vincent Guillermo Ramos, for his closing remarks. Thank you all.
Thank you. So Marlene, I first want to start by saying thank you to you for the warm welcome and for sort of helping to shepherd me along. This was my first meeting as co-chair and got a learning curve. And I think it's definitely been comforting to have you as well as Carolyn and Kay and all the support on Kay's team and Carolyn's team that helped us to organize today's meeting. I thought today was fantastic. It was a powerful meeting. The content was exceptional. It left me with many questions. Folks can't see my notes, but I have many, many notes from the meeting and much more than I can say in the last few minutes. But what I will share are maybe just kind of a high level point. There is tremendous enthusiasm with the newly sort of constituted PACHA. The new membership has infused tremendous energy and lots of really important creative ideas. There was nothing about today, and I'm speaking directly to Carol, but really this is for all of us. There was nothing today that was sort of poorly timed in the wrong spot, shouldn't have been said. It was all perfect and it was a terrific meeting. And I thank everyone for their participation. I want to say that, Jen sort of set the stage on some important recommendations about how we can find levers. And I think that as Marlene and I and the co-chairs from the committees are planning, it seems like it's the perfect time for us to think about what we really want to accomplish and how we're going to be able to do that. So just want folks to know that we heard that, appreciate so much everyone's hard work, and just very grateful to be with a great group of colleagues. Thank you.
And with that, folks, our meeting is adjourned. Thank you. See you soon. Happy New Year. Merry Christmas. Happy Kwanzaa. Happy Hanukkah.
All of it.
Have fun.
All of the
Have
things.
fun.
All right.
Produced by the U.S. Department of Health and Human Services.